Are you ready for some pee-pee?
I like it. Yeah, I haven't always remembered this in the past couple of
Takes me
times.
back. Takes
Yes,
me back.
to a more a much more innocent time.
Yeah,
Heather
about
Parton,
that.
Digby, always a pleasure. We're back. Sam Seder, Emma Vigland, and back with us, Heather Parton, the proprietor of Hullabaloo and, of course, the columnist at salon.com. Heather, there's probably like 12 things that we could talk about on any given Friday over the course of the past, I don't know, certainly 15 years on this show and the 20 years that we've been talking about. Any one of these would have been a full discussion. But that's the nature of the of Trump administration 2.0. The assaults on our government, our laws. Like, I'm just thinking, like, as we went over stuff at the break, we didn't even mention, like, oh, we're probably planning an invasion of Venezuela. And we're just unilaterally blowing up boats in the Caribbean of what appears to be, at least by reports from Venezuela and other places, just, for the most part, fishermen. We really don't know. But let's start with the government shutdown.
Okay.
This is I have to say that in terms of like the messaging and in terms of Democrats maintaining some cohesion and unity and also getting out the message, we just played a clip of AOC and Bernie from their town hall Wednesday night. And there was an opportunity to talk about how Russ Vought is illegally firing all of, the 10,000, the latest tranche of employees, which of course has been going on for 8 months, but hasn't gotten the sort of like the urgent coverage that it deserves. And now we're seeing that. What's your sense of how this is going?
Well, I just wrote a piece about this. I think so far the polls have been showing that people are blaming the Republicans at least slightly more than the Democrats. That's logical. They're in charge of everything. The Democrats are ciphers, up until now. So you can understand why people, even Republicans, would say that. I think that it's, amazing but wonderful that the Democrats have decided that they needed to actually take a stand on something, and that they are pulling together, and that they're doing that, and that they're messaging pretty effectively. I think, we heard that they had chosen this healthcare, framework for their, the ACA subsidies and the Medicaid, for their reasoning, for their rationale for for refusing to vote for the continuing resolution. I was a little skeptical because I thought, it just doesn't seem big enough. It seems too ordinary. It seems like something that happened, this could have been 10 years ago talking. And it was in 2013.
Yep.
We had a shutdown over the Affordable Care Act, and it lasted 17 days. I mean, this, it seemed like, a little Groundhog Day to me. But I'm realizing as I'm watching this go on that it's actually there's a different resonance now. And it has to do with what you said, Sam, about the fact that these layoffs, which we've never seen anything like this before in a shutdown, the idea of we're just going to, fire everybody. We're not, and Trump even out there saying it's going to be all Republican programs. We're going to get rid of them permanently and stuff like that. No one ever said that before. But it's more than that. I think one of the reasons why the healthcare thing, aside from the grim reality of these subsidies going up and people starting to get notices that are going to say, these gargantuan price hikes that they're going to get on the ACA subsidies, and the notion that there's been more press, I think, than we realize on the local level about the effect of the Medicaid cuts on rural hospitals and things like that. That word has been kind of seeping out ever since the big bill was passed. So I think that's all to the good. But I think there's something bigger than that. I think a lot of this is just the dysfunction. Shouldn't even call it dysfunction, because it's really not, the chaos of the Trump administration so far is starting to make its way into the public consciousness. People who aren't paying a lot of attention, people who are just, they're going, wait a minute, what the hell is going on here? And I think that some of that, when in terms of healthcare, has to do with what I'm calling the RFK effect. What he's doing, I mean, this is no longer just about health insurance. It's no longer about your bills. It's you like your kitchen table issues. There's a kitchen table issue out there, called cancer research, pediatric, cancer research. Things like Donald Trump going out in front of standing behind the podium and screaming, "Don't take Tylenol." Like, what the hell is he talking about? This weird stuff like what they did yesterday with Dr. Oz and Trump out there saying, "Have more babies." And I think this stuff is starting to sort of look like it's not just about health insurance, it's about the whole healthcare system. And that makes people very, very nervous, because as much as people hated the American healthcare system in terms of lack of access, they're really going to hate it when they find out that it's really a terrible, terrible system, because we no longer have the best and the brightest doing research. The universities, research centers are being shut down. So I think it's a subtext, this chaos, the fact that they're tearing down the whole healthcare system, the fact that you have this Russ vote thing. I know that everybody's, the press is being terrible about explaining the Russ vote gambit, I think. Because we talked about it, all of us talked about it before the election, that Project 2025, what it was. And this was the main thrust of it, was what Steve Bannon used to call the dismantling of the administrative state, right? Yep. This was what he said, and this is going back to 2016. And Russ Vogt wrote it all out on paper. We all read it. And it was in, very accessible English. And any reporter could have read it too, which said that they were going to do exactly what they're doing. And they started off with Doge. Russ Votes carried it on. All of this idea that somehow this has something to do with the shutdown is nonsense. Russ Votes been doing it. He's going to continue doing it. And right now they just think they're being cute, and they're blaming the Democrats for the shutdown, and it's their fault that people are being fired. But I don't think people are buying it. I wrote a thing, it hasn't published yet, for Salon, where in the AP NORC poll, the AP story about their poll, they quoted a woman, Trump voter, big Trump supporter, said, well, they're all to blame and blah, blah, blah. She says, but, I expect the Republicans to do this. I mean, Donald Trump, he's the strong leader, and we depend on him to go down there to the Congress and tell them exactly what he wants and make them do it.
Well, that's interesting to me, though, Heather, because I'm trying to pull it up, but it's from a few weeks ago. Here it is, actually. There was a poll from YouGov that showed that only 22% of Republicans are buying the party's argument on why they're shutting down the government. And the prompt was to expand Medicaid benefits to immigrants who are, why the Democrats are. To expand Medicaid benefits to immigrants who are in the U.S. illegally. And only 22% of Republicans agreed that was their goal. Like in the voting
Didn't
base.
Did it?
Right.
And they've stopped using that. I mean, I don't see it as much. And partly, I would imagine, is also because of the sort of flood of images of ICE going after, report out today, 170 U.S. citizens have been arrested by ICE.
That's just what they could find, because nobody's keeping data on this. Because that was just what ProPublica found in public, publications and what have you.
But that just means, right? Like, the voter that you're talking about sees Trump as the fixer of even the own Republican Party. This is the thing we've been saying for years on this show, and Sam's really been on this about the separating of Trump from the Republican brand.
Yes.
The Trump voter thinks like he's going to get Republicans in line from cutting your health care. That's insane. And so the ACA thing is fascinating, because like I wish they were pushing for more, but why I think it's creating the tension you're describing is because House Republicans are panicked.
Yeah,
panicked. They're all up in 2026. And if at the start of the year these ACA tax credits expire, that's 4 to 5 million people who could lose coverage, let alone when we're looking at the increase in premiums that would go like crazy. So they time those Medicaid cuts after the midterms. This is the pressure point, and it seems like at the very least Schumer and Jeffries understand that.
They do seem to understand it, which, is surprising. I mean, well, look, what happened last spring, and we were all, our hair was on fire over what they did by, not doing this the first time they had the chance. The logic was, and I think and it has worked out, although I doubt that it was planned this way. What happened in the interim, of course, was, all the Doge stuff, really people understood the Elon Musk weirdness that happened in the first months, but it was also the passage of the One Big Beautiful Bill. And I think that really kind of focused the Democrats. But the big thing that focused the Democrats was Russ Vought doing the pocket rescission and just saying, I don't care what you guys appropriate. You go ahead, you do you. But I'm going to do me. And what I'm going to do is rescind whatever I feel like. I'm going to reappropriate money in any way I want. And when he did that, he showed the Democrats. And this argument, I'm seeing it in the media, and I think it may be starting to, maybe, I don't know, I have no proof of this, but it may be starting to penetrate what this really means. We can't make a deal with these people because they don't honor agreements.
Right.
They don't even honor laws that we pass and that Donald Trump signs. They won't even. So how do we make a deal here? What's the point of any of this if they won't do it? So they're standing there going, no. Russ Vought is out there saying, I'm going to cut whatever I want. What are you going to do about it? And they're kind of going, well, then we're stuck because unless you rein this guy in, we're going to have a problem. And
they have not been able to square this circle, it seems to me, fully. I mean, I think we're headed in that direction you're talking about, but there seems to me to be such an opportunity to say, Russ Vought says he wants to traumatize federal workers. Mm-hmm. And when he traumatizes federal workers, he's traumatizing the people they serve, and that is the American public. That to me seems like a very easy connection to make. And then what you're also doing in that is you're able to tie it into, never mind the cuts they want to do on the ACA. There aren't going to be people to work on healthcare. They're traumatizing Medicare officials. They're traumatizing Social Security officials. Like, you can go forward with this, and particularly at a time where they're putting AI versions of Chuck Schumer saying stuff that he had not said. Maybe it was written in an article, but
I don't think so. I think they made that up.
Well, either way, it doesn't matter. Like, they don't seem to understand that the rules are off there, and it is not a big leap to say that Russ Vought wants to traumatize everybody working in the federal government. I mean, he's literally said that.
It's on film. They've got footage of him saying, and we want to traumatize
there's
people.
Such an opportunity to roll this into any pain that people are feeling from the government shutdown, and roll it into a situation because, look, in the event that we have elections in 2026 and that they're representative of how people vote, and by that I mean, redistricting, et cetera, and in the event that we have a 2028 election, and in the event that Democrats take some power over some part of government, they're going to have to, the work done here, this is not, Biden coming in during COVID and passing one bill. The amount of work that's going to need to be done, our government is in rubbles and in tatters. Yeah. And you need to now start to build a narrative that government is important in people's lives. And you have a perfect example right now of a Republican Party that wants to assault government and thereby assault the American public. They're doing it. They're like we just had the Fed chair, 2 days ago, on top of the Fed chair was out there saying that the immigration policies are hurting the economy. Goldman Sachs is saying, that the immigration policies are taxing Americans an extra 88%. And incidentally, that tax money is being sent. $40 billion is essentially being sent to Argentina. I mean, there just seems to be a lot of material to work with. And I look at it just like, why is AOC and Bernie Sanders the only people who seem to be able to seeking a national platform to make this argument? I mean, I guess Hakeem Jeffries has said that he would debate Mike Johnson, but frankly, despite the fact that Hakeem Jeffries has all the facts, I'd be a little bit nervous about that.
Yeah.
Although I give Jeffries credit. This morning he came out against, talking about Carolyn Levitt's crazy commentary yesterday, and he said she's out of her mind. There's something wrong with her. I mean, he really used some very direct language to describe her, and I thought,
but
okay,
isn't
there's
it
a start?
Yeah, but isn't it
let's play this.
four months too late? I mean, it just feels like he's reacting to the pressure that. Yeah, and they leaked, and just to put that Chiose, who is like a New York, I forget, is he in the city assemblyman or not an assemblyman? He works in the city councilman. Either way, he's floating a primary challenge against Jeffries, and they put out a poll about how he's 50 points behind already. But the point is why are they already polling internally for Hakeem Jeffries?
That's a good question.
Against a council member.
Against a council member, yeah. So sorry, Heather.
Good. That's a good question. I hadn't heard that, but yeah, it shows that there's something going on.
Hey, folks, don't forget to hit the subscribe button and check out our daily show. We do it every day at 12 p.m. Eastern for about 2.5 hours. We even take phone calls. You should check that out.